All right, so I get a lot of questions about what is resistance 1, what is resistance 2 when we look at the Maitland grades. Arguably, you could also say the Greenman grades as well. But the easiest way I explain what the feel is for students is to ask them to use their finger. So if you just take your finger and you just use your other finger and pull it backwards, you're going to get to a point where it stops. And you're like, it stops. A little bit of a stretch maybe, depending, you may have a little bit of discomfort, but for the most part, it's usually a little bit of a stretch there. That is resistance 1, often referred to as R1. If you go further, you get to another one that's, it's grody, it kind of hurts, it's towards the end. That's resistance 2. So I know I'm going through a bunch of joints here, so all you guys are like big time manual therapy guys, I'm trying to get the idea across, not necessarily like being super specific, but R1, R2. So when we look at mobilizations, what you should be doing is going into that R1, and then once you're at R1, you would then kind of stay there or close to there if you're with a grade 1, grade 2, or you'd find R2 and then you back off a little bit if you're staying with grades 3 and 4. So that is the best way I've come across with trying to teach students what that feels like. Now you can apply that same process as you start to do mobilizations of the wrist. You can kind of say like, where do I feel that first stop? Can I get a little bit more? That would be your R1, R2. So don't kind of grab onto that joint you're mobilizing and then go all the way on, all the way off, all the way on, all the way off. Find that first resistance, and then find the second resistance if you can, and then stay in between those two for the time that you're doing a mobilization. So it's been a trick that's really helped out with a lot of students in the past, so I figured I'd share it for everybody else. All right, bye.